Looking for a fast-charging, ultra-responsive stylus for your iPad? Meet the 2X Fast Charge Active Stylus Pen, designed for 2018 to 2025 Apple iPads. Take your creativity and productivity to the next level. Click the link in the video description to shop now on Amazon.
Labour plans to unleash army of door-to-door NHS snoopers to tackle sickness rates. Streeting will explain for the first time why he has abolished NHS England and wants to send health workers knocking on people's doors. The Health Secretary is due before the Commons Health and Social Care Select Committee to detail how he plans to transform the parlous state of services and improve people's health by unleashing an army of community snoopers. NHS England was set up in 2013 by former Tory Health Secretary Andrew Lansley to give the NHS greater independence and autonomy. It was established as a quango funded by taxpayers, but not controlled directly by the government, and responsible for delivering high-quality care, supporting staff, and ensuring value for money. It is being scrapped to bring NHS management back into democratic control. NHS England employs 15,300 people, while the Department for Health and Social Care, the ministerial department responsible for developing and implementing policies and legislation on health and social care in England, employs 3,300. Mr. Streeting says he wants to shift care from hospitals to communities with a focus on supporting people to stay well at home and providing quick community-based care and recovery support. His plan is part of the biggest NHS reform agenda in the history of the health service, which was founded in 1948 by Labour giant Nye Bevan to provide healthcare from cradle to grave, free at the point of use for everyone. We use your sign-up to provide content in ways you've consented to and to improve our understanding of you. This may include adverts from us and third parties based on our understanding. You can unsubscribe at any time. Read our privacy policy. As part of that, he plans to unleash an army of workers as part of a neighborhood health service who would go door to door, with the aim of diagnosing illnesses far earlier. His plan would see a community health worker allocated roughly 120 homes and pay monthly visits to see where their resources can be best used. Under proposals, 25 regions of England would trial the scheme, which aims to lessen the financial burden on bloated NHS by tackling issues like unemployment, debt, and bereavement. Mr. Streeting said earlier versions of the scheme showed really encouraging sign in slashing the number of people who heavily use resources labeled frequent flyers and are responsible for clogging up GP surgeries and hospitals. Speaking to the Express previously, he said millions of fed-up patients are no longer confident the NHS will be there when they need it. After years of crippling strikes, cancelled operations and appointments, eye-watering waste, inefficiency, and bureaucratic box-ticking, public satisfaction now stands at a record low. Mr. Streeting said, "Anyone who works in or uses the NHS can see it is broken, but while the NHS is broken, it is not beat. For most people I speak to, their priority is an NHS that is there for them when they need it, like it used to be." He is due to appear alongside Sir James Mackey, the new Chief Executive of NHSC, and Sir Chris Whitty, the Chief Medical Officer and Interim Permanent Secretary at DHSC, tomorrow.